Breast cancer affects women of all races, but there are differences in early detection, treatment, and survival rates based on racial and ethnic backgrounds. Non-Hispanic Black women are at a higher risk for being diagnosed with metastatic breast cancer and triple-negative breast cancer, which is difficult to treat and spreads quickly. This is due to barriers to health care, such as less access to health insurance and fewer referrals to specialty medical care. Doctors may spend less time with people of color, which can lead to communication problems and affect the quality of care. It's important for Black, Asian, Hispanic, or Latino women to advocate for themselves and communicate effectively with their doctors to ensure they receive the best possible care for early breast cancer treatment. When you go to the doctor, it's important to be prepared. Write down all your questions and concerns before your visit, and don't be afraid to speak up and make sure you're heard. If you have metastatic breast cancer, here are some important questions to ask your doctor. What kind of breast cancer do I have? What are all of my treatment choices? What is the treatment schedule? How will I feel during treatment? How will we check to see if treatment is working? Also, don't be afraid to ask about contacting someone for side effects, what to expect for your caregiver, and what to do if the treatment doesn't work. And if your doctor dismisses your concerns, don't be afraid to ask them to explain why. It's important to make sure all of your questions are answered. And it can also be helpful to bring a friend or family member with you to take notes and provide support. When you have metastatic breast cancer, it can be overwhelming to understand everything about your diagnosis and treatment options. It's important to ask for more explanation if you don't understand something, even if it means your doctor has to repeat themselves. If you run out of time at one appointment, it's okay to ask for a follow-up visit to cover everything. And don't be afraid to ask your doctor to use simpler language if they're using medical terms that you don't understand. It's important to fully grasp what's going on with your health. When you meet your cancer doctor for the first time, it's important to share your concerns and any barriers you may have. This could include things like child care, transportation to treatment, help getting a medical excuse from work, or financial assistance. Your doctor may have resources available to help with these issues, such as a social worker or patient navigator. It's also important to let your doctor know if you have limited health coverage, as there are programs and clinics that can assist those who are underinsured or uninsured. Don't be afraid to speak up and ask for help. Your doctor can't help if they don't know what you need. Dr. Grace Sue, the medical director at the Northwestern Medicine Cancer Center Delner, acknowledges the concerns about how race or ethnicity may impact treatment. Research indicates that people of color often receive lower quality care compared to other races. Dr. Sue encourages patients to ask their doctors to see the standard of care for their specific type of breast cancer. She aims to provide accessible treatment guidelines to ensure that everyone feels confident they are receiving the expected care for their condition. When talking to your doctor, it's important to share your values, beliefs, and any fears or concerns you may have about traditional cancer treatments. You can also express your emotions and talk about any experiences of racial bias in healthcare. This open and honest communication can help your doctor understand where you're coming from and provide the best care for you. For those who are not native English speakers, accessing healthcare services can be difficult. And if you come from a different culture or country, you might not know what questions are appropriate to ask a doctor in the U.S. An interpreter who speaks your language can help open up the dialogue, says Sue. This can help make the patient feel more comfortable and bring up difficult topics that may have felt impossible to discuss in their own countries. Most doctors are required by law to provide a trained interpreter for people who have limited English proficiency, LEP. You don't have to pay extra for this service or find an interpreter on your own. Just let someone on your cancer care team know that you or your loved one needs LEP services. When it comes to your health, it's important to see your doctor as a partner. They may have a lot of knowledge about breast cancer, but you are the expert on your own body and experience. So, it's like having two authorities in the room. If you feel like your concerns are not being listened to, it could be beneficial to look for a different doctor. It's also crucial to be open and direct with your healthcare team about any issues you may have. Your feedback is valuable and can help improve your treatment and the relationship with your medical team. When it comes to your health, it's important to feel like your doctor is on your side. Regardless of their race, you should feel like they are truly invested in your well-being. To build trust with your doctor, they should take the time to introduce themselves, make eye contact, and try to connect with you on a personal level. It's also important that they answer your questions in a way that you understand, and provide follow-up information when you ask for it. If you feel like you need a second opinion, don't hesitate to seek one out. Your current doctor can provide a referral to another specialist, or you can reach out to a social worker or nurse for help. You can also search for a cancer center through the National Cancer Institute's website, or contact them directly for more information.